So good morning everyone. Today we are moving to lecture viral infections. These have been defined as submicroscopic germs which reproduce within the specific living cells, may contain either RNA or DNA. Members of human herpes virus and human papillomavirus family causes the most common primary viral infections of the oral cavity. Herpes simplex viral infections are DNA virus with icohedral nucleocapsid segment and outer lipid envelope and transmitted through saliva or body fluids. Classification: primary herpetic gingivostomatitis and secondary, which is recrudescent herpetic lesions. The classification, which is HSV1, HSV2, VZV, CMV, HHV6, HHV7, and EBV. For HSV1, which is the oral lesions you can see, and for the two, which you can see over the genital area, the lesions, and VZV, which is you can see the chicken pox and secondary infection, sugarless. Then CMV, HHV6, which is called as sixth day of disease, and HHV7 and Epstein-Barr virus. Pathogenesis: the virus bind to the cell surface of mucosae or abraded skin via heparin sulfate and mediate the cell attachment and penetration, which is a neuroinvasive and neurotoxic, and establish and latent infection in the sensory ganglia. Herpes simplex virus infection, which is primary gingivostomatitis, age both children and young adults, incubation period 5 to 7, and symptoms like the local lesions, which by 1 to 2 days include fever, headache, malaise, nausea, and vomiting, and the mouth become painful. Hard palate, attach gingiva and or some of the tongue, buccal mucosa, lips, and may be present on skin. Appearance is after few days of prodromes, multiple small vesicles which are thin walls surrounded by inflammatory base of formed. Then they quickly rupture, leave small shallow oval shaped discrete ulcer 1 to 5 mm in size. The base of the ulcer is covered by the grayish and white or yellow plaque. Acute marginal gingivitis, which is the appearance of generalized marginal acute gingivitis and its entire gingiva is swollen, and ulcers also seen in this case, and there will be difficulty in swallowing. Then healing: the disease is self-limiting and the lesion become healing within 14 days and which leaves no scar. Recurrent herpetic labialis prodrome symptoms like lesion preceded by tingling and burning sensation, swelling will be there, and soreness will be there. Location: the lesions appear on one mil of the lip surrounding the skin, and which is gradually healed with 6 to 10 days, which leaves no scar. So these are the clinical picture for the herpes. HSV in immunocompromised patient, the ulcer may be larger and often occur on non-keratinized site and may last for several weeks. They appear slightly depressed with raised border and presence of 2 mm in vesicles and or satellite ulcer. At the edge of the main ulcer is helpful sign. Other lesions: herpetic meningoencephalitis and conjunctivitis, which is a serious form of characterized by sudden fever and symptoms of increased intracranial pressure. Paralysis will be there. And for the conjunctivitis, which is a swelling and congestion of palpebral conjunctiva, keratitis, and corneal ulceration, may produce blindness. Herpetic eczema and vitiligo is there, which is an epidermal form of herpetic infection superimposed upon pre-existing eczema and is characterized by diffuse vesicular lesions. For the vitiligo, which is an infection of fingers by herpes virus. This is a clinical picture. For the diagnosis, history is needed. The type of clinical features, which is like either the symptoms followed by the eruption or oral vesicles and acute marginal gingivitis, and do not have any history of recurrent herpes. Then HSV isolation, which is neutralization of virus and tissue and culture, is most positive method of identification. Antibody titer to HSV appear in a week and reach a peak in 3 weeks. Direct and fluorescent antigen detection is testing for more accurate than routine cytology. Management: pain control, supportive care, and definite treatment. For the pain control, we can give the lidocaine, and for the treatment side, we can give acyclovir. And the hydration is needed. Recrudescent HSV for intraoral lesion treatment is with 500 to 1000 mg, while cyclovir 3 times a day for 400 mg of acyclovir to 7 to 10 days. Helps labialis with topical antiviral medications such as 5% of acyclovir cream and 1% of penciclovir cream. Systemic therapy, we can give acyclovir, HSV in immunocompromised patient. For patient undergoing hematopoietic cell transplantation who are HSV seropositive, we can give acyclovir 400 mg 3 times a day or 500 mg valcyclovir twice a day. If it is acyclovir resistant, we can give foscarnet or cidofovir. Varicella zoster virus infection, which is primary varicella zoster infection, is also known as varicella or chickenpox. If it is secondary, we can call it as shigellus. Pathogenesis, transmission, respiratory route during incubation 2 to 3 weeks. Virus proliferate in macrophages and disseminated to the skin and other organs. They become latent within dorsal root or cranial nerve ganglion. Other factors increase with the age, immunocompromised patient, HIV infections, leukemia, trauma, and radiation. Incubation period 2 weeks. Symptoms like headache, nasopharyngitis, anorexia, followed by macular, papillary, or vesical eruption on skin and low-grade fever. Location begin on trunk and spread to involve the face and extremities, healed by decomposition, seldom leaving any part after recovering 2 to 3 weeks. Oral manifestations, small blister-like lesions occasionally involve the oral mucosa, tongue, gingiva, palate, as well as mucosa of pharynx. Appearance initially a slight raised vesicles with the surroundings, edema, rupture soon after formation, and forms small eroded ulcer with red margins, closely resembling the epidermis lesion. Secondary infection, herpes which is also called as shigellus or zona, characterized by the inflammation of dorsal root ganglion associated with vesicular eruption of skin and mucous membrane of the area supplied by the affected sensory nerve. Age, sex distribution, it affects the adults, and there is no sex protection. Symptoms like aching, morning pain, and there is usually little, no fever or lymphadenopathy. This is formed with or followed within 2 to 4 days by the appearance of crops of vesicles in a dermatomal or a cystic form pattern. Appearance unilateral vesicles on an erythematous base in cluster up formation, healing 2 to 3 weeks, followed by the scarring and hypopigmentation. So it affects C3, T5, L1 and L2. Then Hutchinson sign also will be present. Oral manifestation involvement in the second division lead to the midface, upper lip, and involvement of third division which lead to low face and lower lip. Side, palate, buccal mucosa, tongue, uvula, and pharynx. Symptoms pain, burning tenderness also present. Signs, vesicles appear which soon after rupture to heal areas of erosion or ulcer. Healing usually takes place 10 to 14 days. Lesion along the distribution of nerve, fluorescent antibody testing, then PCR and biopsy. It shows multinuclear gene cells. Management, ibuprofen pain control. For pruritus, we can give the calamine lotion, antiviral drugs for we can give in the which is acyclovir. If it is secondary, local antiseptic and systemic acyclovir. And the complication, which is like post-herpetic neuralgia, will be there, and symptoms, rash, which is followed by the pain that continues for a week, 2 months. There may be paresthesia, hyperthesia, and aldonia. The first line of treatment, gabapentin, lidocaine. Second line of treatment, opioid. Coxsackie virus, there are RNA retrovirus. They are divided into type A and type B. Transmission, fecal oral route, saliva, and overcrowding, poor hygiene. The herpangina also present, which means vesicular pharyngitis. Aging, young children aged 3 to 10 years, incubation period 2 to 10 days. The site occurs posterior pharynx, tonsils, and pillars. The symptoms like fever, chill, headache, anorexia will be there, etc. And ulcers like lesion starts as punctate macule with evolve into papules and vesicles within 24 to 48 hours. The vesicles get ruptured, forming small 1 to 2 mm ulcers, show a gray base and inflamed at the periphery. Healing generally heal without treatment in 1 week. Acute lymphonodular pharyngitis, young children and young adults. For the site, you can see the lesions appears on the uvula, anterior pillars, posterior oropharynx. Incubation period 5 days. Symptoms: sore throat. Diagnosis purpose: we can give whitish nodule with sore throat, can lead to diagnosis and management. Symptomatic treatment for which is like antipyretic and topical anesthetic. Nutrition supplement which is also needed. Hand, foot, mouth disease. Age children between the age 6 months and 5 years. Symptoms like anorexia, low-grade fever, nausea, vomiting will be there. Appearance, which is macropapillary eczematous rashes, which vesicular lesions will be present. Oral manifestation: hard palate, tongue, buccal mucosa. Then symptoms: sore mouth. Appearance will be like oral lesions are more extensive than herpangina. The tongue may become red and edematous. CMV, which is the virus, is also called as HHV5 and remain latent within connective tissue cells, such as transmission in utero, transmission from utero to placenta, sexual transmission, and blood transfusion. Clinical features: fever will be there, muscle pain will be there, abnormal liver function. Then primary infection of CMV, which is infectious mononucleosis. Then serious complication: meningoencephalitis, myocarditis, and thrombocytopenia. Then moving to oral manifestation: mucosal ulceration, you can say in this case, and salivary gland involvement. For the diagnosis purpose, we can go for the lab investigation. While doing that, you can see the outside formations. Management: pain control, supportive care, and antiviral drugs. Measles, which is a single-stranded negative sense enveloped non-segmented RNA virus of the genus morbillivirus within family Tarmoqlariini. Measles, it is also called as rubeola or morbilli. It is an acute contagious dermatographic viral infection. Transmission, which occurs by direct contact or with a person or by a droplet infection. Transmission. Incubation period 8 to 10 days. Symptoms: fever, cough, and running nose. Onset: or lesions in buccal mucosa, which proceed to 2 to 3 days before cutaneous rash. Apart from this, you can see the Koplik spot. Diagnosis: you can see the typical clinical features like Koplik spot and the history. Lab diagnosis: we can see it is done by the virus isolation and raised antibody titers. Treatment: like we can give the analgesic, antipyretic, drugs like ribavirin, and vaccination is there, which is known as MMR. Second dose, which we can have to give in 12 to 15 months. Moving to rubella. It's the only member of the genus Rubevirus and belong to the family Maternaviridae, and which is also known as German measles. Transmission to the droplet infection. Incubation period 14 to 21 days. Symptoms: fever, headache, anorexia, and lymphadenopathy also present. Rashes, which is present over the face and neck. Oral manifestation: Forshamer's sign also present and pitake. Management: vaccination and rubella immunoglobulin. Human papillomavirus, which is an ancient taxonomic family of non-enveloped DNA virus, has several hundred types of and infection depending upon the type. Mucosal human papillomavirus, which is caused of head and neck squamous cell carcinoma. Then diagnosis: colposcopy is there, acetic acid test is there, then biopsy, DNA test, and pap smear. Management: salicylic acid, imiquimod, podophylax, TCA, trichloroacetic acid, then surgical treatment, freezing with liquid nitrogen, which is also known as cryotherapy, electrocautery is there, surgical removal is there, then laser surgery. Epstein-Barr virus, which is in prevalence of EBV antibody, which is increased in adolescent and early in adulthood, may occur as blood bone infection and saliva, which is also associated with infectious mononucleosis, anaplastic nasopharyngeal carcinoma, Burkitt lymphoma, B cell lymphoma, and hairy leukoplakia. Moving to MC, mollicosum contagiosum. It is caused by the DNA pox virus, which is called as mollicosum contagiosum virus, MCV. It's a common harmless skin growth caused by type of virus that lives on outermost layer of epidermis. The lesions is typically 3 to 6 mm in size, papules that are smooth, flesh-colored domes with a central dimple or some central implicated forms. The time from infection to the appearance of the lesions, which range from 1 week to 6 months. The diagnosis is made on the clinical appearance. The virus cannot routinely be cultured. The diagnosis can be confirmed by the excisional biopsy. While doing the histologically, we can see the mollicosum bodies in the epidermis above the stratum basale, which is consists of large cells with abundant granular eosinophilic cytoplasm. Then treatment will be depend upon the patient age, health, and bumps which appear on the body. So treatments like we have cryosurgery and curettage. Cryo, we were freezing with the liquid nitrogen. And to the curettage, we were doing the excision. Laser surgery is there, and drugs like imiquimod and retinoid we were giving in this case. Thank you for listening my lecture.